You're listening to Power Breakfast with Tessa Dooms.
The time is 7:19. You're on Power Breakfast with Tessa Dooms. We have on the line with us Dr. Aslam Dasoo, National Convenor of the Progressive Health Forum, to discuss the story about the state of healthcare in Gauteng. Dr. Dasoo, thank you so much for joining us this morning. You've been following closely what's happened within our public hospitals in Gauteng. How is it that we've managed to get into the state that we are, where we do not have our doctors paid?
Good morning. Thank you for inviting me. Yes, a very good question. How on earth did we get into this situation? Just for context, we have a National Department of Health, but healthcare is delivered through provincial governments. So Gauteng runs the health service here in Gauteng, for example. And this is a good province to take the context further. Gauteng represents probably the most complex and comprehensive set of healthcare institutions, hospitals, other institutions, anywhere on the continent. To render this system so dysfunctional takes a special talent. And the Gauteng Department of Health has been a poster child of this sort of incompetence that plagues the entire public health system, on which up to 90% of the population depends. So the question you ask is appropriate, and they have to answer that, because the stuff that's going on is so elementary that it should never happen in any healthcare system. Food shortages, medicine shortages, doctors not being paid. This is, I think, a new low for even this dysfunctional department.
And just take us through the specifics of what the markers are of this low. When we say unpaid doctors, how pervasive is that problem? When we talk about food shortages or other issues, how deep is the problem?
Well, the problem, I think more than just the prevalence of it at any given moment, it's the length of time it's been happening. This has been a problem for years and years and years. Activists, organizations, many people they've even gone to court to resolve this matter. All right. So, for example, there were food shortages at Krisani Bara last year and the year before, and this year we're seeing the same thing across the system. The fact that doctors are not being paid follows on the freezing of funded posts. Funded posts. So when posts become vacant, they don't, find new people to take the posts up, or if they do have applicants, the post is frozen. And when you ask why, because you had a budget for it, there's no real answer. So the budget is managed entirely by the Provincial Department of Health. Nothing is managed at the local delivery platform. And the most egregious problem is that the department retains rules that come from the apartheid days to stifle dissent. And they maintain it here so that they can stifle dissent and complaints from practitioners who have been, and professionals who have been denuded of all authority within a facility to run it.
Sure.
And this is, inappropriate anywhere in the world. So when you take the cancer situation, for example, you might have heard of it. The Cancer Alliance has taken this department to court for not providing a service for which it was given money after the fire at Charlotte, some 750 million rand. They have not spent that money. They have gone to court to defend their lack of ability to spend it and their decision not to spend it. Now that the court has ruled against them, they're appealing that judgment. This goes from farce to become actually absurd. These are not people we should entrust our healthcare to.
On the line with us, Gauteng Health Spokesperson has also joined us, Motalatale. Modiba, thank you so much for joining us, Motalatale. What do you say in response to Dr. Dasoo's claims that this is just unnecessary mismanagement?
Well, it's unfortunate that you'd characterize the issue in that manner. And I think we're conflating quite a lot of issues at the same time. And I wonder if we have even the time to even go through the respective issues. But maybe just to indicate, I'll start at the end because it's raising quite a number of issues. On the Cancer Alliance matter, of course, we did give reasons as to we felt that the judgment that was given had missed the material issues in relation to the arguments that were presented at court, and the court has now granted the department leave to appeal. But that is not to say that care has stopped. We're not continuing with care in that case. In fact, I think when later on, when the matter is properly ventilated, it will be proven that actually a lot has quite been done in terms of moving in terms of the cancer treatment, and we're no longer even sitting with that kind of backlog that Cancer Alliance had originally indicated. We cannot fold our arms as a department and not also be able to take action where we feel that we are being unfairly sort of pursued. That's one on that particular issue. But I think on the other issues that he is raising, we are the first to consider that, yes, there are a myriad of challenges that confront the public health system. But again, I think there's a tendency to conflate the issues so as to hype up the problem. Let me come to the issue of the food shortages and all that he's referring to. He cites Bara, but he does not give reasons in terms of that. You recall that, Tessa, previously we had those, at Bara, it was a specific issue that had to do with the food contracts and all of those things. We addressed that particular issue. So at Charlotte Maxeke, which is the current situation that we're dealing with, we did explain that the specific facility experienced challenges because Masakani Cook Freeze, which supplies a number of facilities with meals, had an issue where the municipality, when they were testing the water at that facility, they felt that there was E. coli, and therefore they halted operations at that particular institution, saying this needs to be attended to. That matter was attended to. Measures were put in place, systems were installed in that, and the Cook Freeze then started operating again to an extent that they started then delivering to the affected facilities. But even though they supply several facilities, we had one specific facility, obviously, or maybe a couple of them, that were negatively or heavily impacted. Of course, measures had to be put in place, and we did not shy away from even accepting that. But that cannot necessarily mean that the entire system is collapsing. And I think on the issue of the payments, the issue of the payment of doctors is multi-layered. And if you can indulge me a bit just to maybe explain, there's an issue that relates to a program that we're running around Rivers, a campaign. There's an issue that relates to the appointments that did not follow the correct procedures. There's an issue that relates to the committed overtime, which is really an overtime amount that is paid ahead of time, which in this instance would have conflicted at the same time. And there's an issue of seasonal appointments. But I think maybe at first I must acknowledge the inconvenience. Obviously, this matter
has caused for the actual practitioners.
For the actual practitioners, because also I don't want us to trivialize the matter.
Absolutely.
This is not a real issue that is affecting the bread and butter issues. I think,
and that's why I wanted to give you the time to ventilate without interjection, Motalatale. But also just to say that I think that setting out the scene of what these different issues are really does still come back to the question of, is this not a major issue around mismanagement that is happening across the board? Because when so many issues exist at the same time, I think the public feels like Gauteng Health does have to account for why these issues have been allowed to exist. And I think that's still the question that remains now. But I do appreciate that you have put out what the case is for the complexity of this, and we do hope that this becomes the beginning of a solve rather than us simply lamenting the issue. Unfortunately, we don't have enough time to continue with this, but I just wanted to appreciate.
I would say, Tessa, that perhaps maybe at another time we should set some time aside to just maybe discuss these issues at length, because I feel like the conversation as we've had it now is not doing justice to the real issues
complexity
that we're really addressing. But we do appreciate, I think, the complexity, as you have said, and it's not something that we take quite lightly.
Sure.
And I think we've even said that where we need to hold officials accountable, where certain things do not go accordingly, we need to. But there's also needs to be accountability on the other side. The fact that some people, when we embarked on these processes, refuse to comply with process. Now that it's having an effect in the pocket,
it
now
now
people
has
suddenly
those
are now
implications.
wanting to at the
Sure.
last minute wanting to cooperate. So,
All
but
right.
I think we would need to have some time to really delve into the issue, so that we don't then treat it as if it's a by the way issue. It is
Sure.
a serious issue.
Yeah, no, we have limited time on a breakfast show like this, but we definitely will track this over time. Motalatale, Modiba with us, the Gauteng Health Spokesperson, also Dr. Aslam Dasoo, National Convenor of the Progressive Health Forum.